I'm often asked how skin cancer is treated or detected, and skin cancer usually begins at home with a lesion or a growth that just looks different, something that hasn't been behaving what you normally would expect it to. And so skin cancer is then first brought to the attention either of your primary care, but typically a dermatologist. And dermatologists are trained very well to look at you holistically, to evaluate your whole body, and often map out people, especially at risk for skin cancers, map out their whole body for any lesions they have or growths that may potentially someday become concerning. Skin cancer will usually be detected by the dermatologist, but maybe yourself or the primary care. After it's detected as an abnormality, a biopsy is performed. There's two forms of biopsies. There's a shave biopsy, which is nice because it heals very well. And then there's a full thickness biopsy, where the skin is biopsied its full thickness so that if there's anything wrong with it, we know a little bit more characteristics of it. And that really starts the treatment process, because now we have some data about what this lesion or growth or abnormality looks like and is made of, and then we can begin our treatment plan. So typically the dermatologist will then identify skin cancers such as squamous cell carcinoma or basal cell carcinoma, or even, hopefully not, melanoma. And they'll come up with an initial recommendation and treatment plan, which usually is to remove it. Sometimes this is complex. If it's in an area like the tip of your nose, removing it can be a little bit difficult in the reconstruction process. So we want to make sure that we have a plan in play, how to make you look like you did before as best we can with the lesion gone. But sometimes it's in a very simple area, and usually the dermatologist will just remove it, either right then and there or fairly quickly. Sometimes, if it is a very sensitive area, we'll use a very specific type of removal called Mohs micrographic surgery. And that is a surgery in which the pathologist, which is the person who evaluates the cancer under a microscope, is also the surgeon to remove it. And they remove the cancer and evaluate it under a microscope all in the same day, during the same process. And it takes several hours, and then the tissue is removed. That person may or may not be the one who puts everything back together to look as good as it can. And that's often when I come in, which is to reconstruct areas that are very difficult to put back together because they're in a sensitive area. Sometimes it's to evaluate the lymph nodes that might be associated with a skin cancer and make sure that the risk factors for that skin cancer aren't such that we're very worried about your lymph nodes. And sometimes it's just for a good examination to make sure nothing else was missed. Just to reiterate, I would usually start with your own self-examination, a primary care or dermatologist, and then their recommendations should lead you in the right direction.